Medico Apps PDS Express. Let's see this very interesting question which was asked in the year 2023. So pay attention to this question. So a question says that a patient has completely lost his vision in the left side due to the trauma. So trauma is on the left side and vision loss is on the left side only, and that is very important to note. Now, which one of the following would have been involved? Optic tract, optic chiasma, optic nerve, and visual cortex.
Hello everyone. So are you a NEET MDS aspirant and you are struggling to find all previous year authentic question? What if I tell you that you will get everything in just one book? My book is out on Amazon and Flipkart. Just check the video for description. It contains all the solutions along with the reason to rule out for your convenience. Get your hands on it today itself and take a significant step towards your success.
Now, understand this thing that the optic nerve function of optic nerve is to carry the information from the retina to the brain, or you can say to the visual cortex. So say suppose if my left eye is damaged due to any trauma or anything, my left side visual field will get impaired and I won't be able to see anything because my optic nerve is carrying the information from the retina to the visual cortex. Simple. So if I'm having any trauma on the right side, right visual loss is there, that means optic nerve is involved. Now next thing was optic tract. Now, optic tract also, they carry the information from the retina to the visual cortex, but contralaterally. Say, for example, if I am unable to see, if I got trauma on the left side and right visual field is impaired, that means there has been some issue with the optic tract. I hope I am clear with this. The next thing is optic chiasma. So this is the chiasma where both the nerves, or you can say both the sides of the nerves, they intersect. So the optic chiasma is where the optic nerve from each eye partially crosses and fibers from the nasal half of the each retina crosses to the opposite side. Now lesion at this optic chiasma would result in bitemporal hemianopia. Bitemporal hemianopia. That means I won't be able to see a visual field which is at the temporal side. That would be slightly affected and it would be affected on both the sides, right? So bitemporal hemianopia would be there. Then lastly, there was a visual cortex. So the visual cortex, the one which is present here in the occipital lobe, it processes the visual information. Now, each visual cortex processes information from the contralateral visual field. So, damage to any one visual cortex would typically result in homonymous hemianopia. That means loss of the same visual field in both the eyes, but not complete loss of vision. That's how you can differentiate between optic nerve and visual cortex lesion. Okay. So that is the thing. Coming back to the question, now patient is saying that complete lost his vision on the left side due to trauma. Trauma is on the left side, vision lost is on the left side, and it is complete vision lost. If it have been the partial, you can say visual loss, we could think in terms of visual cortex. But since it is crystal clear, the answer is optic nerve. I hope it was quite clear to you now. Thank you.